What is the long-term prognosis for mantle cell lymphoma? Imagine facing a diagnosis that is complex and challenging, yet with hope for better days ahead. Mantle cell lymphoma is a type of non-Hodgkin lymphoma that mostly affects older adults, usually between the ages of 60 and 70, but it can also occur in younger individuals. This disease can sometimes seem slow-growing under the microscope, but in reality, it often behaves more aggressively than other low-grade lymphomas. Recent advances in treatment have improved the outlook for many patients, but mantle cell lymphoma remains a serious condition. The prognosis depends on several factors, including the patient's age, overall health, how advanced the disease is at diagnosis, and how well the lymphoma responds to initial therapy. Looking at survival rates, studies show that about 55 to 63% of patients are alive 5 years after diagnosis. This means that just over half of those diagnosed will survive at least 5 years. The 7-year survival rate is around 63%, especially for those who respond well to treatment and do not relapse early. Younger patients, particularly those under 65, tend to have better outcomes, with 5-year survival rates reaching as high as 82%. Conversely, for patients aged 75 and older, the 5-year survival rate drops to about 55%, and for those over 80, survival tends to be less than 3 years on average. The likelihood of the disease not progressing, called progression-free survival, also varies. Younger patients might experience about 6 years before the disease worsens, while older patients often see shorter periods. Achieving a complete response to initial treatment is a positive sign, as more than 80% of patients respond initially, but many will experience relapse over time. If the disease progresses within the first 2 years of treatment, the outlook is generally less favorable compared to those who stay in remission longer. Recent developments in targeted therapies, such as drugs like ibrutinib, and combination treatments have helped improve survival rates. However, it's important to remember that mantle cell lymphoma is currently considered incurable with existing treatments, and most patients will face relapses at some point. Because of this, personalized care plans are essential, taking into account each person's age, health, and disease characteristics. Ongoing monitoring after treatment is crucial to catch any signs of relapse early, and participating in clinical trials might give access to newer therapies that could further improve outcomes. While statistics can give a general idea, every individual's experience is different. Some people live many years with a good quality of life thanks to effective treatment and supportive care. In summary, mantle cell lymphoma is a serious disease, but advances in medicine have made it more manageable. Younger and healthier patients tend to have a better chance of long-term survival, but the disease often relapses, especially in older adults. It's important to work closely with healthcare professionals to develop a tailored treatment plan and to stay vigilant with follow-up care. Remember, ongoing research continues to seek better treatments, and hope remains for improving long-term outcomes for everyone affected by this condition. Always consult your healthcare team for advice specific to your situation.